Hi everyone, I'm student nurse Christine Jones Alsa, and today I am going to demonstrate surgical hand scrubbing, donning sterile gown, and close gloving. So I'm going to perform surgical hand scrubbing first. So for the definition, it is a vigorous and lengthy cleaning of the skin of the hands and forearms with water, antiseptic agent, and scrub or sponge to create friction. It is also called the counted stroke scrub. So the purposes of surgical hand scrubbing are to remove dirt and skin oil from the hands and lower arms, and also to reduce the microorganism count to as near zero as possible.
For the expected behavior, first is we have to check for completeness of supply to save time and effort and prevent having to stop. Apply a cap and surgical mask to provide a barrier and reduce the spread of microorganisms from the hair and respiratory tract. In surgical hand scrubbing, pieces of jewelry should be removed, including the wedding ring if any, because jewelry harbors microorganisms. Also, we have to make sure to trim our nails, and there should be no nail polish or artificial nails worn, because microorganisms collect in cheap nail polish and under artificial or long fingernails. Stand before the sink, keeping body away from it to prevent uniform from getting wet. Turn on the water and adjust the pressure using the foot or elbow control. Free hands from touching anything, the water should remain running. Hold hands above elbows and wet the skin from fingernails to elbow. Since hands will be the cleanest, and once the scrub is completed, follow the principle of allowing water to flow from the cleanest area to the most contaminated area. Wet and apply approximately 1 tablespoon of antimicrobial soap on the palm and works up a lather for 1 minute. Soap emulsifies skin oils and contaminants and facilitates the removal. When using the pre-packed scrub brush, sponge pad, open the package and remove the nail cleaner and clean the nails and discard. Once the scrub is begun, the brush is never put down until the scrub is complete, as it would then be contaminated. Remove the brush and discard the wrapper. Do not set down the brush once the scrub is begun. If the brush or sponge is not impregnated with a cleaning agent, moisten the brush or pad and dispense the soap onto it. Using a circular stroke, scrub all skin surfaces starting from the nails. Nails should be cleansed 30 strokes with brush. Next area will be the fingers, each side, and web spaces. So it should be 20 strokes using sponge. Next area is the palmar surface with 20 stroke using a brush. Next area will be the dorsal surface with 20 strokes using sponge. The last area will be the forearms using 20 stroke each third with sponge. We just have to repeat the process on the other hand and continue the scrub because the scrubbing action loosens resident bacteria and contaminants and it facilitates removal. So circular motions mechanically remove the microorganisms. Dispose the brush on the proper receptacle and rinse the soap from your skin, allowing the water to run from fingertips to elbows. Water should run from the area of least contamination to the area of most contamination. Use foot, knee, or elbow control to turn off the water to avoid contamination of the hands. Keep hands up, in front of, and away from you and walk to the table where the towels are kept. Pick up the sterile towel by using one end and allow the towel to unfold. Dry each hand and arm with opposite ends of the sterile towel working from the fingertips toward the elbow. Drying prevents irritation of the skin, and we have to make sure to dry from the cleanest area to the most contaminated area. Discard the towel properly. Keep your hands above your waist at all times. Keep your hands in your line of vision to prevent contamination.
So now I am going to perform donning a sterile gown and close gloving. So for the definition, the nurse must wear a sterile gown in the delivery room so that sterile objects can be handled comfortably with less risk of contamination. A gown is applied after surgical hand scrubbing and after the nurse has donned a mask and a surgical cap. The purposes of this procedure are to provide a barrier between microorganisms on the nurse's uniform and the client, to maintain microbe-free covering over the nurse's uniform, and to prevent a nosocomial infection associated with invasive procedure such as handling delivery.
For the expected behavior, first is we have to inspect the autoclaving tape used to secure the gown. Note that it confirms the sterility of the contents. When packs are sterilized, a special tape is used which change color pattern with heat. Contents should not be used if the tape color remains unchanged when heated. So we have already done mask and cap and we already performed surgical hand scrubbing. Next step that we're going to do is to pick up a gown grasping inside surface at the collar. Hands are not completely sterile and inside surface of gown will contact clothes and skin surface so it is considered contaminated. Stay away from the sterile pack and table. Hold gown at arm's length away from your body to allow the gown to unfold by itself. Be careful not to allow gown to touch the floor or any unsterile field. Contact of outer surface of gown with a dirty or clean surface would result in gown contamination. Hold gown by inside and open shoulder seams and insert each hand through armholes. Inside surface of gown is considered contaminated. Keeping upper arms in front of you at shoulder height, extend hands toward gown cuff. Do not push hands through cuffs. Extension of arms straight ahead keeps sterile outer surface of gown in view and reduces risk of touching floor or a portion of your body. Having circulating nurse to assist by reaching inner side of the gown and pulling inner shoulder and side seams onto your shoulders. Working from behind scrub nurse prevents contamination by circulating nurse, and gown should fit comfortably. With hands still inside the gown, open the sterile inner wrapper of the glove on the sterile field. This is to prevent contamination of the sterile gloves. Using dominant sleeved hand, grasp the cuff of the gloves for the non-dominant hand and lay it on the extended non-dominant forearm with palm up. Place the palm of the glove against the sleeve palm with fingers of the glove facing toward the elbow. Only sterile items come in contact with each other. Manipulate the glove so that the sleeve thumb of the non-dominant hand is grasping the cuff. With your dominant hand working through its sleeve, grasp the upper side of the glove's cuff and stretches the cuff over the end of the cuff of the gown. Prevents the hands from contaminating the sterile gloves. With the sleeve dominant hand, grasp the cuff of the glove and the gown sleeve of the non-dominant hand. Slowly extend the fingers into the gloves, making sure that the cuff of the glove remains above the cuff of the gown sleeve. This will provide a close sterile method of gloving. With the gloved non-dominant hand, put the glove on the dominant hand by repeating the process. This is to maintain aseptic technique in donning gloves on the dominant hand. Adjust fit and remove wrinkles of the gloves.